Hello, everyone. My name is Christopher Booth. I'm one of the senior enrollment managers here at Western Atlantic University School of Medicine. Thank you, everyone, for joining us tonight on this virtual information session, where we're going to be discussing our match rate here at WAUSM and how we got to it. So we do have other virtual information sessions that will be happening later in the year where we're going to get really in depth with our curriculum. So today we're going to just do a little bit of an overview of our curriculum and then really get into talking about match. Joining us tonight are some great guests. We have Dr. Paula Wales, who is our provost and chief operating officer. We also have Danielle McDonald, who's our vice president of student affairs. And then also joining us, I'm so proud to say for the first time publicly, are Dr. Eric Hadhazy, Dr. Jonathan Dallas, and Dr. Nicholas Guevara, who are former students and now graduates of Western Atlantic University School of Medicine. And they're going to be talking about their experiences as well. So thank you all so very much. Also joining us behind the scenes are my colleagues, Dr. Elvin Avila. I'm sorry, not doctor. I've been saying doctor a lot. Or Elvin Avilas, who's one of our senior enrollment managers. He'll be checking you in. So if you get a private message from him, just let him know who you are so you can make sure that we mark you as present. And then also Xavier Marcus, who's another one of our senior enrollment managers, who will be answering questions. So as we go through the evening, if you do have any questions that come up, please make sure to put them in the chat and we will answer them as quickly as humanly possible. So with that being said, let's jump right in. Once again, I am Christopher Booth, one of the senior enrollment managers here at Western Atlantic University School of Medicine. And what we're really excited to talk about today is, I'm going to sort of give away the ending, our 100% match rate, which we're really excited about with students attaining residency both in NRMP and also CARMS, which is Canadian Match. And we're going to be talking to both Dr. Wales and Danielle McDonald about the academic and student services portion, and then also talking to our three graduates. And really talking about this idea of WAUSM supporting students from matriculation through to match. So to get ourselves started, Dr. Wales, I want to come to you and find out, how would you describe the intentional design behind the WAUSM MD program?
Well, thanks, Chris. Hello, everyone. It's nice to see everyone tonight. Thank you for joining us. How would I describe the intentionality of the curriculum? So the curriculum is designed to be highly integrated and developmentally appropriate so that students achieve each of the milestones they need to achieve to reach the ultimate goal, which is to practice medicine. The ultimate goal for medical school is to graduate from medical school and attain a residency. And to do that, you have to actually learn the fundamentals. You have to understand the basic science underpinnings of things. You have to understand clinical presentation to be able to put them together, pass USMLE or United States Medical Licensing Examinations 1 and 2. You have to be able to pass an OSCE, which is a clinical skills program. So I'm giving you a very high overview, and that is we intentionally create every single piece to work together in lockstep to take a student down what I'll call the road to residency. They start as lay people where they don't really know that much about medicine, and they end up where they are today with an MD after their last name.
Amazing. And a little bit of, I think, what makes us different as an institution is our flipped classroom model. So I wonder if you would talk a little bit about that flipped classroom model and the reasoning behind it and how you think it ends up affecting students in their clerkship. And just so to give some context to those watching, once again, the way to think about your medical school journey is to think about it split into two parts. There's pre-clerkship, which is learning the sciences, and then there's clerkship, which are getting your clinical experience. So in the pre-clerkship, Dr. Wells, if you could talk a little bit about the flipped classroom, please.
Sure, happy to do that. So again, our curriculum is highly integrated. So most of the time you'll see a basic scientist and a clinician in the room. The flipped classroom model is such that students have everything they need to know put into Canvas, meaning all the things they're supposed to read, videos they're supposed to watch, pre-work, if you will. They do this work beforehand, and then they come to class. And generally speaking, classroom time is an application session, a time where you can put together or use what you've learned. And we do that for a very intentional reason. And that is, well, someone might be able to Google me and check this fact. And that is, um, medicine is changing. The amount of medical knowledge doubles every 70 days, which was the last time I looked. I remember when medical knowledge doubled every 10 years, and then it was doubling every 7 years, and then it doubled every 5 years, right? Now we're down to medical knowledge doubling every 70 days. So what that means is it's completely impossible for any medical school to teach you everything you need to know the entire time you're a practicing physician. So the best thing a medical school can do is teach you how to learn information, how to assimilate, how to evaluate, how to synthesize, and how to move forward. Because there are things that we can't even imagine right now that these three gentlemen will have to use in their career. What we can do is help them figure out how to learn and separate the wheat from the chaff, if you will. So our curriculum is designed so that students intentionally practice assimilating information and learning it and then applying it. And they do that iteratively over and over and over again until they are what we call master adaptive learners. So everything we do is based on taking this information and rather than, you know, I'm kind of, I'll be dating myself here a little bit, but in medical school, we used to have people memorize things. They would just memorize long lists of factoids, right? And they would memorize these long lists of factoids and didn't really have a lot of practice applying them or learning how to learn when information changed. And they would just pick that skill up like during residency or while they were practicing physicians. That's no longer possible because the information changes so quickly. Our students have to be master adaptive learners when they hit residency. The information is going to double every 70 days, right? They're going to be in residency 3 to 7 years, depending on what their specialty is, right? So just the information that's going to change while they're in residency is mind boggling. So if a student doesn't learn how to learn and they learn how to learn through this flipped classroom model, um, I don't really think they could be very good physicians later on. So
Amazing. Thank you
I
for
don't know
the
if that's
answer.
what you were looking for, Chris, but that's
No, it's great.
okay.
It's great. And so our students in their pre-clerkship are going to be on our campus in Freeport, Grand Bahama Island. And then they transition to Chicago for clerkship. So I kind of want to, right at this moment, I want the three students to introduce themselves, or former students, sorry, to introduce themselves. We'll start with Eric. Um, Let us know, your obviously your first name, last name, where you're from originally, where you matched residency and what your specialty is going to be in, please. And then I have a question for the three of you as a group. So we'll start with Eric.
Sure. Well, hi, everybody. Thanks all for joining tonight. So my name is Eric Hadhazy, originally from Annapolis, Maryland. I did a stint in California prior to coming back. I was in Florida and then was in Chicago for clerkship and then got a general surgery match at Anne Arundel Medical Center in Annapolis, which is where I wanted to be and incredibly excited to be back home where it all started with family.
Amazing. I just to give you one correction, I think that's Dr. Eric Haphazard. Got to get you into that.
Great.
You got to get used to that. Okay. Dr. Dallas, is it okay if I call you that?
I mean, I guess, yeah, sure. Hi, friends. Thank you all for joining. My name is Dr. Jonathan Dallas, which is still wild to say. I'm originally from Modesto, California, right smack dab in the middle of the state. I matched into child neurology at the University of Wisconsin.
Amazing. Thank you. And Dr. Guevara.
Hi, my name is Dr. Nicholas Guevara. I got to get used to that one. I grew up in Melbourne, Florida. I got into surgical prelim at University of Illinois Chicago, um, and that's where I'm going to be for the next year, and hopefully after.
Amazing. Thank you. The reason I wanted you three to introduce yourselves now is because I feel like what Dr. Wales was saying in terms of the flipped classroom for pre-clerkship, it's great, right? And we talked about that in other virtual information sessions. What I would love to hear, starting with you, Eric, is how can I phrase this? give me an example of something that you did in that pre-clerkship that had direct impact on your clerkship. So Eric, if you wouldn't mind.
Sure. I think there's a lot of elements, but I think the PCC, well, sorry, PCC is it's a technical term there, but basically the simulation lab and some of the things we did there, I think really prepared us for clerkship and being really hands-on. I think we had a huge advantage coming into some of the other students who almost used the clerkship opportunity as their first chance to really be exposed, it seemed, to patients. And a lot of the students that I saw observed at WAUSM and personally we already felt very comfortable with patients and that interaction. So I think that element of having that really dedicated time in the simulation lab, standardized patients, and really just having that much dedicated time to it in pre-clerkship translated really well to clerkship.
Amazing. And Jonathan, if you wouldn't mind maybe explaining a little bit more what the simulation lab is, and even going into some detail about what your transition from pre-clerkship to clerkship was like.
Yeah, absolutely. So the patient-centered core PCC is each semester you're on the island, you are still getting clinical, should I say, experience in quotation marks, where you are given a patient who has a script. They're not, a real patient yet. That's for clerkship time. And it's up to you and your team to kind of figure out what's going on. So that's most of the weeks. Other weeks, you go into sort of the high intensity simulation labs where they have different simulations plugged into the program. And so like I will never forget our very first patient. He started seizing and I was the team lead that time around. And I literally looked to my team. I'm like, what do you mean he's seizing? And I will never forget that. So, but it gives you sort of the opportunity to kind of be in that state of shock of like, oh my gosh, what do I do? Before you get to Chicago during your clerkship and you don't have that freak out moment that you had, just around all your friends. You don't have to have that freak out moment, when you're in front of your attendings and other residents that are teaching you. You're kind of ready to go. My transition, it was so my transition, that when we were able to leave the island, I moved back home for a little bit because we had to take step one before, or sorry, we didn't take step one before we went to Chicago. So I know it's a little different now, but I had a few months just to study, relax, kind of get ready to go. But the learning never stopped, right? Even though I was off the island and wasn't quite in clerkship yet, the learning never stopped. And when I found out that surgery was going to be my first rotation, I I asked the attending, I was like, what's the number one things that I need to know for today, like for my first day? And he's like, know the steps of an appendectomy and a cholecystectomy. Those are the two things that we do the most here. So I went home, studied, learned how to learn back on the island and was applying it. And on the first day of my first patient, the attending looked at me and he said, Jonathan, you're scrubbing in on this appendectomy. I was like, oh gosh, okay, sure. And he we were going through the surgery and he said, what if I leave a little bit too much of this appendix? And he said, oh, well, then this is me saying like, well, you can cause stump appendicitis. And he turns to me, he's like, you know what stump appendicitis is? I'm like, yeah, I read about it, like all nervous. But it was because the island taught us to learn how to learn that made the transition super easy.
Awesome. I like that you say the island taught us, like we were in an episode of Lost. Nicholas, tell me a little bit about your experience in clerkship and how you felt that pre-clerkship set you up for success.
Um, Yeah, I think that pre-clerkships helped us going back to PCC or patient-centered care. After the simulations, after any case that we had, we have a debrief with the attending or with our professors. We'd go over all the clinical steps, what we look for, what test to order, but also since we're prepping for step one, we're going over the basic sciences of everything, why things happen. So we're connecting the clinical stuff at the same time as we're connecting um, the step one stuff, the basic sciences, which really does help. Some attendings really do like to ask you the nitty gritty, and those things come up. And I feel like me and my colleagues were very well prepared for that. I remember seeing them be very proud of us and be happy that we knew some of the stuff that maybe some students forgot because once they took step one, it was just like brain dump out of their head. But the school did a really good job of like combining the two, so they weren't just exclusive; they were mutual, and they like worked together for us for the time that we were at clerkship.
Amazing. Thank you. Um, Before we move on, Dr. Wales, I wonder if you could, because I realize we may not have explained exactly what the simulation lab is. If you wouldn't mind explaining a little bit about the simulation lab. And then also, Jonathan brought up rotations. If you wouldn't mind talking about what the core rotations in the first year of clerkship are.
Sure. So So the simulation center, if you will, is a space on campus that has a variety of things. So there's a space dedicated to standardized patients. Now, standardized patients are real people, just like Jonathan was talking about, who have a script. So they come prepared to interact with students, and students get practice like listening to real human hearts, talking to them, asking questions. You get a chance to ask very sensitive questions to a standardized patient so that you can practice on a standardized patient rather than having to ask very sensitive questions for the first time to a real patient, right? So you learn to examine on a real on real people who are simulated patients. We also have professional patients. So professional patients are people who actually have certain conditions, like they might have a heart murmur or they might have a certain condition. And so they sometimes come to campus and you can actually hear what one of those heart murmurs sounds like in one of those patients. We also have the sim bays, which have mannequins in them. And so what you're looking at here are standardized patients. And so there's students interacting with real patients who have learned a script and are there. I think there was a picture of Eric in there. It just, so that's what you're looking at. Then this is the simulation center where there are mannequins, right? So these mannequins can cry, they can talk, they can sweat, you can push medications. They do all sorts of things. So this was probably the patient that was seizing for the first time with Jonathan, right? So this is a task trainer. So this is a heart machine. So you can see all of the students are listening to hearts. You learned it's called Harvey, and you listen to heart sounds. You listen to normal heart sounds. You listen to abnormal heart sounds. So we have all of these things going on in this space. One thing that I don't think we looked at were task trainers. So we have task trainers so students can learn to intubate rather than learning on a real human for the first time, right? So there are lots of opportunities for students to practice. The one really great thing I think about our simulation center, not only do students start doing this from the very beginning of the curriculum, but they also have access to the rooms whenever they want. Like obviously if class is going on, you can't go in there, but otherwise you can go in and practice at any time. That's quite unusual because the equipment is extremely expensive, very specialized. So students often do not have unfettered access, but ours do. And they use it. They actually go in and practice, which is fantastic. So they practice in the simulation center. They practice with the mannequins. They practice with the task trainers, with the standardized patients, all to prepare for the clerkships. So when they land in the clerkship, so that very first year of clerkships, students spend 48 weeks divided into 6 different specialty areas. So they spend 12 weeks in internal medicine, 12 weeks in general surgery, 6 weeks in family medicine, 6 weeks in psychiatry, 6 weeks in OBGYN, and 6 weeks in, what did I miss? Pediatrics. I'm looking at you, Jonathan. How can I miss peds? So, and those are sort of the 6 core clerkships that all students must take. Then they slide into their 4th year, which is largely filled with selectives or electives. One of the selectives that I like to share, all of our students must do a sub-I or a sub-internship. This is really important. Not all schools do this, but a sub-internship is where a student acts like a resident. So they take on additional patient responsibility, and additional experience on the ward. So when a program director sees that a student has already had experience sort of serving as a resident, they're comfortable with them coming onto their residency program. Students also must take a selective, if you will, in either emergency care or urgent care, that kind of thing. And then they slide into electives, and that's where they get to tailor the curriculum so that they take the things they want to take, maybe that they're interested in, They might take things that they'll never get to take again, like for whatever reason, they would like to see, say, if you're going to be a general pediatrician, you're not going to be a pediatric surgeon, you might want to take a rotation in pediatric surgery just so you can explain to your patients what they might experience should they need to have surgery. It's also an opportunity to take what I'll call our audition rotations. So Eric really wanted to go back home for surgery. So Eric could have taken, and I don't know if you did, Eric, I'm just bringing this, you could have taken a surgery elective back home, which might make him more attractive to the residency program director, obviously, if Eric does a great job while he's there. So I would say that electives are worth their weight in gold because they can be used for so many different things. And we haven't talked to Danielle yet, but Danielle is one of those people who, probably the main person who meets with students to say, what is it that you want? Eric, where do you want to go and what do you want to do? Jonathan, where do you want to go and what do you want to do? Nicholas, how about you? And she works very closely with the students to make sure that the electives they get or that they end up taking actually help them when they go to match into a residency program.
Well, Dr. Wells, you read my mind because I was about to bring Danielle McDonald into the conversation. Danielle, once again, our Vice President of Student Affairs. Can you talk to me a little bit about, or talk to us rather, a little bit about how student affairs complement the academic experience for the students?
Of course. Hi, everyone. I was so tuned in. I was like watching as an I forgot I was a panelist. Um, but pretty much from a student affairs perspective, we understand that medical school is hard. We understand that students are juggling a lot of things. So there's a lot of administrative things that happen on the side as you're going through medical school that we kind of handle on the background. So we support students not just from the administrative side of helping guiding them through policies and advising them through their various transitions, but you will actually see us directly from your admissions representative. So we are at the airport as soon as you land in Freeport, welcoming you, getting you transportation to your housing, doing your welcome week, which is equivalent to our orientation. And from there, you work with us from not only transitions, not just general advisement, but we also have under our umbrella counseling and wellness. We have our academic support folks who are from the Center for Academic Success who are also there. So really all support services are right under the OSA, Office of Student Affairs umbrella. So we are really the most consistent faces that students see, regardless if they're in Freeport or if they transition to Chicago or if they're doing electives. Like, and I would hope I can say this, and the students would probably agree, our graduates, is that most students are familiar with the Office of Student Affairs. They know who we are. So as I mentioned, and the great thing about us is we are separate from assessment. So we're not involved in your assessment. We're really a place where you can be vulnerable, where you can get feedback. And ultimately, we want to take care of you because for us, success in our students are not just these great milestones that our students are hitting, but it's also once you leave our WAUSM as a medical trainee, can you move on to residency and take care of yourself and make sure that you're taking care of your wellness, you're providing that mentorship to those behind you and ahead of you, being those leaders on the floor. So that's what we really look for when we're on everything that we do in our office, really.
Amazing. Thank you so much. And would you mind speaking a little bit more on the systems that are in place that can really help students feel supported, both academically and personally? And I want to give some context. I think one of the things that I think is very different about WASM is the support that we offer students. So yeah, I would just be interested if you could speak a little bit more on that, please.
Absolutely. And one support services I completely forgot, which is the purpose of this webinar, is we also do career advising. So, but just to answer your question, Chris, what academic support looks like for us, because we have small classroom sizes, we are really, interested in helping students match their learning styles to the right resources, the right strategies. Not every student learns the same way. Not every student, consolidates information in the same way. So like, how are we challenging ourselves to be in the know of the new ways of helping students learn? So within our Center for Academic Success, we have an educational psychologist who leads that department. And then we also have a physician who's also part of it as part of our learning specialist in the clerkship years. And we recently just hired someone else to join that team officially yesterday. So the purpose of the academic support is for our students to really, you know, work on those things. So if you are struggling as a test taker, you know, pre-med, you're mostly coming in still trying to figure that out. Now, on top of that, you're throwing all these additional resources, AMBOSS, URL, all these things. How do you condense that? How do you not go out there and grab everything that you see because you've read reviews and you heard the person next to you it works for? So we really help students individualize their learning because success looks different for every student. And that's something that I think all of us within our office is very just proud of, is that we really treat students differently based on their learning because their outcomes are going to look very different. And we have that space to do that with such a small class size. So I would say, you know, for students who are out there watching, you know, it's easier to go into bigger programs where you kind of have to navigate this. You kind of rely on your peers to figure out what works and test things out, trial and error. But I would strongly, as someone who also works with career side of it, I would strongly advise against that because trial and error should not be in your medical school journey because you're creating a profile for residency. So we want to see less trial and errors and more how are we figuring out these milestones so that we can see success and you have that aha. So when you leave WAUSM, you're not going into a residency program where you can pass step 3, where you can pass your boards and you've kind of learned those tools that are needed that work for you.
Mm. And how do you balance that support with the rigor of the program?
We are pretty embedded in the curriculum in terms of the schedule. So for our Center for Academic Success, there are actually required courses, or excuse me, required sessions that are actually a part of the student schedule. So it's not something where students have to, you know, step away like while we are there for students to walk in, but we actually have presentations and whatnot. We also ensure that we have various touch points with our students through orientations that we have before clerkships, welcome week, which introduces students to all of our resources and helps them work it out before classes even start. So between office hours that they have with their faculty, between one-on-one appointments with us, between group sessions, we're pretty much, I can almost say I know where every student is in our school and in their journey. And I can say the same for my department.
Amazing. Thank you. I'm curious. I want to go back to you, Dr. Wales, for a moment, and then we'll come back to the students, obviously. WASM has achieved something I think fairly unheard of, this 100% residency match. And I wonder, and this residency, we've had students who've matched in California, Texas, Illinois, Louisiana, North Carolina, Florida, just to name a few. And they've matched in specialties from child neurology, Jonathan, emergency medicine, family medicine, pediatrics, surgery, general surgery. So I'm curious to know what specific structures were put into place. And Danielle, feel free to also jump in as well, because I do think there's some super specific things that student services does. But I'm curious to know what structures were put into place to help support the students in that achievement.
Yeah. So I'll start, if you don't mind, Danielle. I'll start, and then I'm gonna quickly pass it to you. So my involvement has been, I hired a superstar. And what I mean by that is Danielle's going to get embarrassed and probably blush. But you're right. Most brand new medical schools don't have, or in general, most medical schools do not have a 100% residency attainment rate. That is unusual, except it's not unusual for Danielle and her team. So Danielle and I worked together at Nova Southeastern University, the new MD program there. It was a brand new medical school in the United States. Every year that Danielle was there, we had a 100% match rate. And so when I came to WASM, I was trying to recruit her from the moment I came. I was like, please come, please come, please come. She eventually came, and our very first, and I know I put a lot of pressure on her because I told everybody that she got a 100% match rate. I mean, it takes a whole village to do this, but she really sort of, and I think the students will agree, sort of guides them along the way, whether they want to be guided or not. she holds them accountable for the residency, which is great. And so what I did was I hired Danielle because I know that she has a system that works. And she's done a phenomenal job. And I would not do it justice if I tried to explain it. She has like a whole series of career presentations, which these guys can all talk about. But honestly, I think it's really important to go to a place that's had success or have people help guide you who've had success, because it's a difficult game. It's a really difficult game, and she's mastered it. And I'll stop. I'll stop talking.
All right. Well, I'm officially embarrassed, but just to talk a little bit about just the approach. I've been a part of many medical schools where advising when it comes to residency starts in year 3. And I will say there's many times where, while I wasn't like necessarily leading the charge of that career advising, there were students who I would see that just didn't have all the information in their hands. And I was all, they were kind of making career choices where they're going to spend the rest of their career in a place based off of, I liked my rotation, but I'm not sure if I really have a full scope of this, but I really liked it because time really wasn't on their hand. And I will say, while every match day is an exciting time, there was some students who I just knew just matched in certain specialties because that is what was just available for them at the moment. They wanted to get through that match year. That was the class they were going through. So as Dr. Wells mentioned, when I was able to go to NSU, they kind of gave me a blank slate of you can create it from scratch. And one of the things that I use, and we give all of our students a token, is the AAMC Careers in Medicine advising model. And essentially what that is it's meant to give early exposure to medical students earlier on. And so I remember when I was just looking into it, I was like, you know what? As someone who has a huge student affairs hat, like I'm in this field because I was the one listening to students when they were going through their challenges when I was just a coordinator. And I used to always say, like, man, one thing I learned about medical students is that, we kind of train you to a point where you become a really A-type personality, where that control needs to be in place. And when you feel like things are out of control, it doesn't feel as safe and secure. And so with that kind of evolved our career model, which is early exposure. So we do career advising from semester 1 all the way in welcome week. So I will be flying to Freeport tomorrow because my career presentation with the students who are starting this semester is on Friday. So we start from earlier on of this is what this arena looks like. This is why we're having these earlier conversations, because the great thing that you have as a semester 1 student is you have time. You have time to go and explore. You have time to join interest groups. You have time to start interest groups. You have time to kind of figure out what is going to work for you and what are your true interests. As you develop as a medical student, what you came in wanting to be may change. Do you have that space to navigate and make those decisions? So that involves early exposure from the career side of it. As we go on, we also have workshops that we have every semester. And then once they get into clerkships, we have different types of conversations, still career, but it's more towards how do you start collecting some of the documents that you're going to need for residency, such as letters of recommendation. We have mid-year checkpoints. We have planning your electives so that you're not just your summer and the electives that you're planning matches up to your the residency that you plan to apply to or the specialty. And then once 4th year really kicks off, we have a series of webinars in the evening. Funny enough, right after this meeting, I'm starting the first webinar for the Match of 2027, so it does not stop in my world. But we do these series of webinars to slowly prep the students going through this so that it's in digestible pieces. And pretty much, I would say, with that, we also are really data driven. So we give our students tokens to the AAMC Careers in Medicine portal where they can see all this information for themselves. They're not just listening to Danielle or to advisors or mentors. They see the data over years to be able to make informed decisions. So I'm going to stop.
Thank you so much. I wonder, before we move on to speaking with our 3 graduates, Danielle, if you wouldn't mind talking just a little bit. I kind of highlighted it a little bit, but I'd love to hear you talk a little bit about a little bit more rather about the diversity of outcomes that we had in the match, both in the US and in CARMS, the couples match thing, because it is a very diverse match. So yeah, if you wouldn't mind talking about that a little.
Yeah, we had students apply to various specialties. We had PM&R, which is an advanced position. We had the general primary cares, internal medicine, the family med. We had, as you can see here, general surgery, child neurology. We also had students who did couples matching, and so they were successful as well. And then we had our only Canadian that was in this group who applied to CARMS match, not just in Canada, but right back in her hometown, which was something that she strived to do. That was the first conversation I had with her actually when I went to Freeport and met her. She said, I want to go home after this. So I'm leaving my family for a few years, but I want to go back home. And so just to see that full circle and seeing her going back home was really just great to see. And we had our student, one of our Bahamian students, also match, and I think we just, you know, the goal is always, it's always, and I tell the students this all the time, like I want students to be happy. So I don't want you just to match. Like I want you to match and be excited. So I love to hear the Eric stories, the Nick, the Jonathan. Like I got into, especially Jonathan, I knew since day one was neurology. I know at first he was neurology and then it shifted to child neurology. And after that, he was pure that. So like seeing that full circle of you didn't just get your job, but you went back home or you got the job that you're looking for. That's what makes all this worth it for me and for the team that supports the students as well.
Amazing. Thank you so much. Thank you, both Danielle and Dr. Wells. And I will be coming back to the two of you, but for now, I'd love to transition over to speaking to our three graduates. Eric, I wonder if you would tell us a little bit, because there's people on this call tonight who are in the exact same place you were 4, 5 years ago. So I'm curious to know what sort of led you to WASM and what your experiences were like on the front end versus what your experiences are like now, someone who I think you literally graduated this past Saturday.
Yeah, exactly. Absolutely, if anybody thinking about it, life's one of those things where there's never a good time. I would say just do it. Time passes by so quickly, and the next thing you know, it's gone, in a good way or a bad way. So it was not an easy decision for me to go back. It's kind of a second career for me. I'm older, a little bit older, to go back. There was actually a little bit of headwind from folks, friends and family, like, what are you doing? But I plugged ahead and went with WASM. I could start right away. I, took my leap of faith with the school, and it was amazing. And the faculty were amazing. The admissions team were amazing. They will be there with you the whole time, step by step. And they will work with you as much as you want them to. If you're a little bit more hands off, and sometimes I am, some people are a little bit more, they want a little bit more interaction. They do that too. So I would say if you're thinking about it, just do it. It will be the best decision you've ever made. It will be incredibly challenging. Have no illusions about that. It's a lot of work and it's continuous. And you feel like you have a break, and then you realize you don't. But you stay on top of it and you do your due diligence, you are going to get through, and you'll be sitting exactly where I am, and it will work out for you.
Amazing. Thank you. I want to take this over to Jonathan. You kind of talked about this already, Jonathan, but I would love to hear you say more about this. Uh, so we hear on our end, and let me give you some context for this question. We hear on our end things that, like Dr. Wales tells us, that when we first started our this is my Dr. Wales impersonation, by the way. When we first started our clerkship, we were one of just a number of international schools, and after a semester, we became the only international school at this particular hospital. So, and this kind of leads me, you said something, Jonathan, so I would love to hear you talk a little bit about what was your mic drop moment in clerkship where you were like, yeah, I'm here. This is real. I'm doing this.
Yeah. Oh, a good mic drop moment. So we during my fourth year, I was doing a pediatrics elective. It was my first elective at the hospital that I'd done my pediatrics core rotation at. And I had already, I had known at this time that's like child neuro is what I want to do. I made sure to let all the attendings know that I was working with, like, hi, I'm Jonathan. You may remember me. It's been a couple months. I want to do child neuro. And they would look at me and they're like, I don't know how much experience you're going to get out of here, but sure, like we'll figure out, what to do. I don't know what kind of curse I brought to the hospital that month, because I feel like every other case we had was a child neuro case somehow. And there was a kid that came in, he had a really bad fall at school, and had like all the typical post-concussion sort of symptoms going on, super lethargic, didn't really know up from down, left from right, could kind of keep like his parents, like he knew who his parents was, but that was about it. Um, but then all of a sudden he started to desaturate, and the attending is talking to the parents, trying to get the story, which he was at school, so they don't really know. They're just going off of what the school nurse said. And me and the resident just kind of looked at each other while the child was desaturating, and I was like, should we do something about that? And the resident's like, no, the attending probably has it. Like she can see it. And I was like, no, I'm not going to let this kid need to get intubated in the ED. So I just kind of went over, put a nasal cannula in his nose. And then that's when the attending decided to look over, and she was like, oh, we should probably call for critical care transport, because I'm not going to be intubating this child in our ED. We're going to get him to, a more advanced hospital that is better equipped for pediatric emergencies, which this turns out was very quickly becoming. And so it was like at that moment, it's like, oh, I am doing this. Like I feel like a doctor.
Amazing. Thank you so much. And I'm sure the family of that child thanks you very much as well. Nicholas, I'm curious to know, how important was the small class sizes to you into your journey? And I would love to hear your moment where you were like, I'm doing this. I'm fulfilling this kind of goal that I've had.
Well, to answer the first question, the small sizes was really great. I came from a bigger undergrad school. I went to Florida State, so the classes were 150 to 200 people. And then when I got more into my major, there were like at most at least 60. But now I'm going into a classroom where my class was 39 at the beginning. The professors really get to know you on a personal level. Like Dr. Sloma, Dr. Coleman, they know your weaknesses, they know where your strengths. So during the lecture, sometimes if they catch you not paying attention, they will just gently remind you, hey, like this is where you've been struggling in a quiz. And it's that kind of like relationship that you get with the professors. And then when you see my graduation, like I did Saturday, and then you're able to talk to them and you're able to give them a hug and say thank you for being hard on me, thank you for like pushing me on the areas that like I would struggled in, is like a really like incredible moment, something that like I didn't get in my undergrad. Being in such a big school, I don't think many of my professors even remember who I am. But I know that at WASM, all my professors know. And the small group settings with my table mates and the tables behind me, and we would split up into groups. It was great because you may be like really good at one area, but then someone in front of you may be good at a different area that can teach you and fill in those gaps that you may be having a hard time filling, and things that you may not want to ask in class, or the professor doesn't have time to teach you, but someone can just quickly be like, hey, it's just like this. This is the quick way of doing it. Then I guess my big moment, I guess, would be my fourth year. I went out to Kern in California. That was one of our sites for fourth year. And when I was doing 76-hour weeks of my trauma rotation, and I was put in charge of one of our trauma patients. I stayed with them for 6 hours, uh, resetting like fractures, wrapping all his injuries, and just letting the resident know what was going on, and then being able to scrub into the very long case afterwards after a night shift, which was it was demanding, but it was really good and cool to know that I can handle it. Something that is very intimidating going to a general surgery specialty is the amount of work that everyone tells you you're going to do and how you know what's going to happen. But actually living it and doing it, and knowing that you were able to go home, you're able to handle it and see it and experience it. That was a moment that I was like, this is what I want to do. This is where I want to be, and I was really fortunate, really happy for that situation.
Amazing. Thank you. Thank you for sharing. And I'm curious to know, staying with you, Nicholas, did you, so once again, your specialty is, your residency is surgery, correct?
Yes.
And did you come into school on day one knowing that that's what you wanted to do?
I wanted to go into surgery. I came in wanting to do ortho. I spent a lot of my life as a kid breaking a lot of bones. And I lived at the orthopedic office for a very long time when I was a kid, and I had ankle surgery for an ankle disease. So I wanted to do that because I thought I could relate to patients more, knowing everything I've been through. Once I got more into ortho, I realized that it wasn't my cup of tea. It wasn't as exciting as I thought it was, but surgery was still something that I loved. I shadowed a bunch of doctors prior to med school, and being at St. Anthony, our core location, and then my fourth year electives, I just solidified that that's like where I want to be. Being in the OR is my happy place. Everything else could be hard, stressful, but when I'm in the OR, that's just, I don't want to be anywhere else.
Amazing. And how did career advising support you as you sort of made that realization about where you started and where you were headed?
Well, I mean, honestly, if it wasn't for Danielle, I think I would have pulled out. It's a very stressful time. It's really nice to have someone on your corner, because you see the metrics, and of course they're there to guide you, and they're there to give you like like more information about what you can and can't do. But it's also intimidating and scary because you don't want to be jobless. But having someone that reminds you of why you're doing it and what you want to go into is really nice. And she was there advising me and helping me kind of just continue to solidify the fact that that's all I wanted to do, and that if that's what I wanted to do, I could have to keep going doing it. And thankfully, I listened to her, and I was able to match, especially at one of my top programs, because I got to work with the program director in my third year, so I built a relationship with her. But being able to actually make it happen was a really great moment.
Amazing. Thank you so much. Jonathan, coming back to you, I wonder if you would talk a little bit about maybe a time in which advising or feedback that you got sort of changed some of the work that you were doing or helped you.
Yeah. eh, you know, Nick was saying that the OR and ortho are his happy places. I can't stand ortho. Bones are for me gross. And so MSK was a little brutal for me, and anatomy, just learning anatomy, except neuroanatomy. I love neuroanatomy, which is normally like the opposite for most people. But anatomy was always a struggle for me. It still is, while I'm, reviewing for step 3, things have been a little difficult when it comes to anatomy. And so having the opportunity to sit down with, our anatomists who are fantastic, professors, it just would not click for me sometimes. And the amount of hours that I spent in Dr. Coleman and Dr. Derricott's office, sort of too many to count. But at the end of the day, they wanted to make sure that it's like, okay, we understand that this is a weak point for you. Let's get you to a point where, you can do the best you can and try to focus on your other strengths elsewhere. And that, it's through, a combination of Centers for Academic Success and, working with the faculty, because they work very close hand in hand with each other. At least that's what it felt like from the student perspective. And so being able to come at it from that analytical standpoint really helped me a lot, sort of get through anatomy, so that I can focus on other things that I do like. Did that mean that I had to spend a little bit more time on anatomy than, other things that I enjoyed, like immunology and micro? Absolutely. But again, yeah, I'm going to stop there. But yes, it was great.
Amazing. Thank you. And Eric, I would like to kind of address something. I think unlike some of your classmates, you were also a dad while you were, and you still are a dad, but you were also a dad while you were a student. And I think one of the things that doesn't get spoken about enough about med school, and I certainly talk about this to incoming students, is the sort of, I will say, emotional toll that med school can take on a student. So I'm curious to know about the support systems that were put into place both in your clerkship or your pre-clerkship and your clerkship to help support you, because you were also, going to school and being a dad.
Yeah, yeah. And I also had back surgery. Don't recommend that one either during med school. But
Okay. All right.
so yeah, no, you got to have that support network. My daughter now is 3.5, but she was born about halfway through first year. So I missed, and school was incredibly accommodating, but I probably missed 10, 14 days total. And I, picked up right where I left off, but that was a lot. And obviously traveling back as much as possible every, couple of weeks, a couple of weekends. You've got to have that support network in place. And it's, being a new dad or mom is stressful inherently. And then you obviously put that together with trying to study and cram all the time. I wouldn't recommend it, but it's absolutely doable. It'll just be tough going in. I mean, that's the thing. But if you have that support network, you'll get through it like anything else. And now it's just fantastic. And we are back. I'm actually going to be at the hospital I'm training where my wife was born. So full circle.
Amazing. Amazing. So we're getting a little close to time here. Before we kind of wrap up, I would like to return Danielle to you. Um, just because there's like a part of Match that I think people don't talk a lot about, that I've heard internally you all speak a lot about. I'm curious to know the kind of support system that the school gave to students in terms of the actual like interview process for Match and how to approach it strategically. I'm curious if you would mind speaking a little bit about that.
Sure. So as I mentioned, we have the series of webinars all throughout the summer. And once students are towards the end and about to submit, we have a preparing for interview season webinar. And then after that, this is where we talk about all the things to be mindful when you're going through an interview, expectations, what is expected of you in terms of preparedness, what can you expect in this process, virtual, in person, what are some good questions to be prepared for. So we talk about the basics. And then after that, we have the same faculty and staff who've kind of been involved in the student journey. They all volunteered to offer to do mock interviews. So we train them before they start working with our students, and we give each of our students at least 2 mock interviews we require them to do, and just so they can get practice. So like if the first one doesn't go as well, okay, great, you can come back and do it again. But students are welcome to do multiple mock interviews, and the goal is to really catch some of those things. So as you can see, and I'm just like even noticing it now with our folks right now, just talking on, just being mindful of like eye contact, things like that that we lose in that virtual setting. And then just, being prepared. It's such a nerve-wracking part of this process because great, your application, your academics, everything got you through the filters and the reviews at this institution. Now it's up to this interview for you to determine where you fall on their rank order list. So while you think the hard work is done after submitting your applications, yeah, I got an interview. That's just the halfway point. The other half is getting high on their rank order list so that you can have a match. So we've been doing mock interviews. We gave them feedback. We recorded them so they can see. And so, yeah, that's something that I think is really the fun part, because it's like, now let's talk about what you submit on your application. Let's kind of get through some of those topics that you may not want to speak about, or, your whys. So that's pretty much what a lot of our faculty and staff are involved in those mock interviews. And hopefully this year we'll get some alumni.
Oh, nice. Nice setup.
Did I say there?
Yeah, yeah. Cool. Eric, I'll go back to our student panel, and then I'll end things with Dr. Wales. All roads lead to Dr. Wales. Eric, if you could give the students watching this webinar one piece of advice, what would it be?
I think if you are intrinsically motivated to do this, you will succeed. You have to just know it's going to be challenging, and it will be, but you will get through it. If you stay hungry and motivated, you will get through it.
Jonathan, how about yourself?
I'm sorry, I'm going to have to ask you to repeat the question because I'm responding to someone in the comments right now. But what was it?
Oh boy. No. What piece of advice would you give someone watching the webinar now if they're thinking?
Oh, this is my always go-to. You have to want it. It's the work is not going to get done for anyone else, for you. And it took me a little bit to figure that out. And I'm glad I did finally figure it out because I have the cute little letters after my name. But yeah, you have to want it. And if you don't want it, it's unfortunately going to show.
Nicholas, piece of advice.
I mean, I'm gonna have to echo that, but also add that find a good group of friends that will help you and support you. Medical school is hard. Not a lot of people will understand you or get the sacrifices you have to make, but the people around you in your class will, and they may be able to teach you a lot of stuff that you don't know, and you may be able to help them out too. And at the end of the day, you are all going to be doctors, and there's no better feeling than that.
Amazing. And by friends, you're referring to the back row crew, correct?
Yes, I am referring to the back row guys.
Amazing. Oh, cool. Yeah, and I want to address a question that happened that was asked at the very beginning of the webinar, and then once again I'll sort of end things with Dr. Wells. And it was a question about someone said, "Oh, well, are you guys sort of prepping for these match rates and these? And we also have 100% pass rate for USMLE Step 1, Step 2, and OSCEs. We literally could go on for another hour about these things. But someone asked, are you guys sort of priming the pump by your selection process? And I want to say there is an element to that is true, but it may not be what you think. There are students who we look at the admissions process extremely holistically, and at the end of the day, what we're looking at are things that Eric, Jonathan, and Nicholas brought up, which is this what you really want? Is this it, and are you willing to fight for it? Because it can be a fight. It can be something I talk to students about a lot is this idea of concrete roadblocks versus conceptual. The concrete roadblocks to what Jonathan were talking about is this idea of like, are you more primed towards surgery? Are you more primed towards neurology? What sort of scratches the itch of your mind, right? But the conceptual roadblocks can be the really hard ones, which are, am I worthy of this? Do I want this? Do I have what it takes? And I think what the school does is what we look at is, do you have that fight in you? And are you willing to go through this process? Because as you can tell, listening to Danielle and Dr. Wells, they're willing to get into that fight with you, but they have to know that you're willing to go on that journey as well. So with that being said, Dr. Wells, I'd love to give you the last question, which is, you've been here from the beginning of the school, and now you're here at our first graduating class. How would you summarize how WAUSM helps students through matriculation to match?
That's a really great question, and I think everything WASM does, like I can't pick out what everything WASM does is done very intentionally with the goal of the students being successful. So the curriculum is developed in such a way that students can master the material and be successful. They're given a ton of educational resources to help them prepare. They are given support. The faculty have open office. It's not office hours, like in undergrad where they might be in their office for 2 hours on a Thursday. Our faculty are always in the office. They're come in, and you walk right in. Student affairs is like that. You walk in. I remember Jonathan telling me that he got to first assist. I remember that. Your first day in surgery, you're like, I got to first assist. And I'm the provost. I don't know, oftentimes you don't get to see the provost if you're a student at a school. So my point is, everything we do is for the success of the student. And there's some of that is altruistic. There's some of that's selfish. And the selfish part is we know our reputation as a school is completely built on the performance of our students, right? So not only do we want all the students to be successful, but we want our school to be successful. So what I think, I can't answer your question, Chris, in that there's not one thing that we do, but every single thing we do, every system that's put in place, every form that exists. Like these guys will know, we have curriculum feedback forms on a QR code in every classroom. If something happens in the classroom that you think we should change, you pop up the QR code and send us a note. And we discuss that in every curriculum committee meeting. The first thing we do at every curriculum committee meeting is have the students go first. That's just who we are and what we are and how we decided to build this school. We don't look at students as students. We look at them as junior colleagues, people who are joining the profession of medicine. And so we're not like, we have to evaluate them and assess them, but it really is to develop and grow them. And that's what Danielle was talking about, developing and growing students so that they come in as lay people. They collect a lot of basic science knowledge, a lot of clinical skills, but they also leave as leaders. These guys have all been in the brand new Student Government Association, brand new interest groups. They've all led important things that our school has done. They're all alumni here on this very first webinar for alumni. I mean, they literally got their degree a couple days ago. And so I'm not answering your question very succinctly, but everything we do is built around student success. And what I will say is I think the people in our school care about each other. I think the faculty care about the students. I think the students care about the faculty. I think the staff care about the faculty and the student. We're all in this together, rowing in the same direction, trying to have success for everyone. That's why we have 100% pass rate on step 1. That's why we have it on step 2. That's why we've had 100% match rate. 100%. One thing we didn't talk about is an externally evaluated OSCE, which was evaluated by faculty who are outside of our school. They come and they evaluate our students. Every single one of our students has passed that OSCE on the first time at the end of their 3rd year. So what I am not saying very briefly is everybody cares. And when everybody cares, amazing things can happen. And that's what happens, in my opinion, at our school. I tell people this all the time. It's the best school I've ever been at. And I've been at some amazing schools. But I don't know if that
Amazing.
answered
Thank
your
you.
question, Chris, but you probably don't want to
No,
ask.
I think it answered it perfectly. I think someone in the chat said, so you start working with students on week 1 of school. And I would say we start working with you for the minute you hit submit on your application, because our jobs in admissions are to help you through the process. And by help you through the process, it doesn't mean, did you get your paperwork done on time? It means, are you presenting yourself in the best way possible for an admissions committee to make one of the biggest decisions of your life? As we wrap up, I just want to let everyone know on this in this webinar, there are some questions that were asked that are better answered by your senior enrollment manager. So we will be reaching out to answer questions for you. There is also opportunity for you to come and visit the school. We have student visits coming up June 18th, July 23rd, and August 6th. And we think it's so important for you to come and see, touch, feel, smell the school, to see what that experience is like. It's very powerful, and you get an opportunity to talk to students and have lunch with them. And all of us in administrative, we take a hike, so you can really get their in-depth feedback on what they're going through. And so I think it's very powerful for you all to be able to experience that. And so, and Dara, I will put it in the chat, those dates. But once again, it is June 18th, July 23rd, and August 6th. And yeah, I think your answer summarized it perfectly, Dr. Wells. What is the secret sauce? The secret sauce is that we care. And I think that you can see that in our students, and you can see that in the passion of our faculty and our staff. Everyone really cares. I want to thank everyone tonight. We're going to wrap it up for now. But I want to thank all of you for joining us tonight for just over an hour. And I really want to thank Dr. Wales and Danielle McDonald for giving their time to us, and thank Elvin for checking people in, and Xavier for answering questions. And I really want to thank the true stars of tonight. Once again, Dr. Eric Hadhazi, Dr. Jonathan Dallas, and Dr. Nicholas Guevara. It is so exciting. I'm so excited for the 3 of you. And what I'm excited for are the patients and the lives you're going to change. That's truly what we got into this business for, is to change lives. And I think the 3 of you are going to do it. So thank you all so much. And we will be in touch. Good night. Thank you.